Anybody in this room getting numbness or tingling in their hands, feet, toes, legs? If you don't mind sharing with me, any part of their body, numbness or tingling? Okay, quite a few people. What about burning pain in their hands, toes, feet, legs? Again, those are symptoms of sick nerves. If your nerves are just cells, nerve cells. If they're sick, okay, they'll misfire. And sometimes people with peripheral neuropathy, just putting the sheet on their toes can be excruciating, okay? Or just having shoes on or socks will feel very uncomfortable because the nerves are giving bad information to the brain. What about hand pain? Is anybody experiencing hand pain? Quite a few people, okay? What about back pain, pain going down the legs, bulging discs, failed back surgeries, neck surgeries that lead to all sorts of numbness and tingling and all different sorts of pain cascades? So just think about it. Let me ask you this. If you're getting any of these symptoms, numbness, tingling, burning, cramping, does that mean that that part of your body's functioning at 100% or less? That's really what I want to share. I think most people understand that, is disease means weakness. If I have a disease in a part of my body, that means that part of my body is literally getting weaker. Does that make sense? If I have heart disease, is my heart getting stronger or weaker? If I have kidney disease or lung disease, are my kidneys or lungs getting stronger or weaker? So that's what disease means. A part of my body is weakening. So if I'm getting nerve problems, if I'm getting pain, numbness, and tingling, does that mean that my nerves are getting stronger or weaker? So just think about it. By understanding that simple concept, what would be the only way I could actually get healthy again and get better again? If a part of my body is getting weaker, I would have to turn that around and get that part of my body what to start getting healthier? Stronger. So if I want to regain my health, whatever part of my body is weak, I have to start strengthening it. Does that make sense? That's the only way to get healthier. Health means strength and regeneration. So I have to start strengthening a part of my body if I want to get healthier. Okay, so one of the biggest drugs that's used in peripheral neuropathy is Neurontin. You might know it as gabapentin. Anybody here hear of gabapentin? Okay, pretty much the whole room, right? Okay, so gabapentin's actually a brain drug. It's an anti-seizure medication created for people with seizure-like brain disorders. That's why it was developed. So disorders like epilepsy and drugs that cause different seizures. Now think about it. If I have a seizure, what happens to my brain? It literally, it's in the word, it seizes, it locks up, it overfires. And if somebody has a seizure, what could happen to them? They could literally die. So they'll put you on a drug like gabapentin or another anti-seizure medication. What does that do to the brain? It slows the brain down. So anti-seizure medications slow the brain down and the way the brain fires. So if I slow my brain down, I'm going to be less likely to have a what? Seizure, okay? But they'll use it off-label for all sorts of pain disorders. So pain in my legs, my feet, my arms, my back, anywhere I'm having pain. Because think about it, if I put you on a drug that slows down your brain, what are you going to be less likely to feel? Your symptoms, okay? But it's doing absolutely nothing to stop the progression of your disease. All diseases start, and over time they get what? Worse. So if here's my neuropathy right here, it's a thing, right? It's a disease process. Here it is. If all I ever do is take gabapentin or some of the other drugs that I'm about to mention that cover up my brain, cover up the condition, just slow my brain down, I'm just covering it up. I take it every 4 to 6 hours. What's going to happen to this condition over time if all I ever do is just cover it up? Is it going to get better or worse? Am I going to get stronger or weaker? Sicker or healthier? That's it. So what I want you to understand, on a scale from 0 up to 100%, how much does this drug, or the drug that I just mentioned before in the previous slide, actually help you recover and heal from your neuropathy? 0. But there's one thing that's almost paramount to all those other things I just mentioned to be able to achieve, maintain good health, all organ systems in my body functioning at a very high level. It's almost one of the most important things, right? What am I talking about? What am I doing right now? I'm moving, right? Movement is crucial for the body. When I move, what does it do? Does it weaken my body or strengthen it? Okay, it pumps more blood to my brain. It prevents my brain from shrinking with age. It increases my mood, decreases pain hormone, regulates digestion, regulates blood pressure and glucose levels. It does everything positive for my body. It keeps all parts of my body strengthening and toned. Does that make sense? So just think about it. When you start to develop neuropathy or pain or back or feet problems, right? You're not feeling good. Do you start to move more or less? So if you're looking at your body like the stock market, right? If you start to move less, do you think your health's going to start trending towards health, or is it going to start trending away? And you're going to start to develop all, other comorbidities, other health problems, blood pressure and glucose problems, because without movement, your body starts to deteriorate. And one of the greatest indicators that we have as human beings that lets us tell us whether or not something's good or bad for us is by how we what from it. Right? How we feel. That's our internal navigation that lets us know whether or not something's good or bad for us by how we feel from it, right? Think about it. How did you ever know you were sick before in your life? Because you what? You didn't feel good. How did you ever know you got better? I felt better. Isn't that, it's so simple? You feel better. So when you're doing things that are good for your body, you start to feel what from them? Right? If you, barring that you're healthy enough to do it, but let's just say you went for a nice 20-minute walk, right? Go for a nice 20-minute walk, right? When you come back from that walk, how do most people feel after a nice, good walk? Energized. Good. Your mood's better. I feel better. Everything about you feel good. But I am going to share with you the actual root cause, the main thing cultivating and driving the disease into your body. But it's not number one. But number one's a pretty big one, being diabetic or pre-diabetic. If you have high blood sugar levels in your body, do you think that's toxic to all the cells in your body? Yeah, it's very bad for all cells in your body. Can diabetes cause blindness? Yes, because it damages the what going to your eye? The nerves going to your eye. So if it damages the nerves going to your eye, can it damage the nerves in your fingers, your toes, your legs, any part of your body? But the root cause of all peripheral neuropathies, this second one down, the thing that's cultivating it, driving it deeper into the body, is literally poor circulation, or more pointed, poor microcirculation. So I'm not talking about you went to a vein clinic and you went to a doctor and you got some varicose veins removed, or you got some sclerotherapy or something like that. What I'm talking about is the smallest units of blood flow called capillaries. Has anybody ever heard of capillaries? Tiny little blood vessels. Those tiny little blood vessels are feeding your nerves. If that capillary swells up and becomes inflamed, and now I can't get blood to those nerves, how well do you think my nerves are going to work if I can't pump blood to them? What would happen to any part of your body if you shut off blood flow to it? Right? It would shut down, because what's in your blood supply? Oxygen, hormones, immune cells, water, growth factors. Everything that a cell needs is getting brought to it through the circulation system, right? So here's my nerve functioning at 100%. It's a nice, robust, healthy nerve. Now I start shutting off the blood flow like a valve on a hose to those nerves. What's going to happen to that nerve? Is it going to stay at 100%, or is it going to start to drop down in function? And what am I going to start to feel as that starts to happen? Symptoms. But here is really a depiction or a characterization of a nerve in varying degrees of health. So this top nerve is what we want all our nerves to look like, okay? If your nerves look like this top one here, you do not have neuropathy. That's a nerve functioning at 100%. You can't get better than 100%. So we can see here is the nerve is nice and thick here, nice and robust and healthy, and the blood supply is really, really healthy as well. We can see those capillaries. So if your nerves look like this, things are going to be great. But if any of the things that we said on the previous slide start to happen to us, diabetes, the aging process, autoimmune diseases, any of those, it starts to damage the blood supply. So does the blood supply here look better or worse than the one above? Worse. So we would call that a diseased blood supply. Think about it. If the blood supply becomes diseased, what do you think the nerve's also going to become? They're intimately connected. Sick blood supply, sick nerve. Any one of those diseases will totally ruin somebody's lives as it progresses. Neuropathy is no different. As it really progresses, somebody will maybe end up on a walker, in a wheelchair, not being able to take care of themselves. So it's very, very, very far-reaching, but many times it's just not explained, okay? So what are your choices? You could do nothing. I don't recommend that, okay? You can go to your primary doctor. You can get referred to a neurologist. Oh, and all these doctors, they have obviously your best interests, and they're doing the best job that they can for you. A lot of people go to a lot of acclaimed and esteemed doctors, okay, with fantastic credentials, but they're only able to treat you with the tools that they're equipped with, yes? And the only things that they can treat you when you're going there is with certain medications that they have. They can do symptom management for you. That's the best they can do. So they're still doing the best job, but unfortunately for this condition, it doesn't really work to get you well. If I'm taking a drug, right, that doesn't get to the root cause of the problem, whether or not I try one drug that doesn't get to the root cause, 2 drugs, or 40 different drugs, will I keep getting success or failure? Just think about it. If it was going to work, wouldn't it have worked already? Everybody here, like I said, has been to some wonderful doctors, but it's not working because it's not actually getting to the root cause of the problem. So your peripheral nerves can regenerate and heal and strengthen as long as they have not been killed. What's the only thing that kills your nerves? Lack of what? That's right, blood supply. So as long as I can return blood back to that sick area, it can start to rebuild and heal. And that's fantastic news. Now let's talk about some of the strategies to do that. Okay? So just based off of that information, when do you think I should take action when I still have a what? Blood supply. As long as there's a blood supply there and you're within one of these phases, you can absolutely turn things around and start to build your health and get well. So the 4 key steps to feeling better. Number 1, we have to rejuvenate the nerves by increasing blood flow. Does that make sense? We have to stimulate the nerves to start firing correctly. When my nerves start to become sick, do they fire stronger or weaker? Right? Disease means weakness, so my nerves start to fire weaker, okay? Also, we have to activate the muscles through specific therapies. Think about it. My nerves tell my muscles how to work. So if my nerve becomes weak, what's also going to become weak? My muscles. So we have to do specific therapies to strengthen up that whole connection. And matter of fact, when people have neuropathy, literally their brain, parts of their brain starts to become weak as well. I want you to think about it. Your nerves are literally long tails coming off your brain. Does that make sense? If I have a nerve in my foot, I can trace that nerve back up my leg, into my spinal cord, into a part of my brain where it starts. Does that make sense? So if my nerve becomes weak, what also becomes weak? My brain. So it's all a chain of weakness. So we have to strengthen up that whole chain. And when we do it, it works fantastic, okay? And then we have to empower the nerves by decreasing inflammation. If you have a lot of inflammation around an area, does that seem like the right conditions to allow a part of your body to heal in? Isn't everything about conditions though? Think about it. I'll give you another example in nature. If you take an acorn, which has the potential to become an oak tree, right? And you throw an acorn into the corner of this room, does it become an oak tree? It'll just crumple up into dust in about a week because it doesn't have the right what? Conditions or environment, okay? But if I throw it into fertile soil, it has the right amount of sunlight, water, nutrition, minerals, everything it needs. In a very short amount of time, that acorn is going to sprout, and years to come, it'll become one of the strongest trees known to man, right, as an oak tree. Completely different outcomes based on what? Different what? Conditions. Do you think your body's any different? You have to give your body the right conditions, and then once you give the body the right condition, now it has the opportunity to heal. You have low-level laser therapy and high-powered. They have different applications. High power doesn't mean it hurts or damages you or does anything bad. It just has a little bit more pushing power. And as a result, it does some things that low-level laser therapy doesn't. So it really increases proteins that your body needs to rebuild and heal. It also increases blood flow. It also teaches the nerve how to start firing correctly and really lowers the inflammation around the area of the body that is sick to create the right conditions to cultivate healing. So this laser really is the Ferrari or Cadillac of all lasers when it comes to rebuilding cells and getting healthier. Now, what I want to do is just elaborate a little bit on how these lasers work, because I think some people want to know that a little bit. So I'm going to just touch on it just briefly. And we kind of alluded to this, a little bit ago when I started the talk. Okay, when we talked about motion. Okay, one of my greatest professors taught me this concept. He said, Motion is life. The amount of motion that an organism has is directly proportionate to how healthy that organism is. Now, I know that sounds a little wordy and heady, but I'll give you an example. Has anybody here heard of an amoeba before? A single-cell organism? If you looked at an amoeba under a microscope, what would it be doing? Moving. If it started to slow down in its motion, would you assume that it's getting sicker or healthier? And if it stopped, you would assume it's what? So the amount of motion that it's expressing is directly proportionate to how healthy it is. Now, you can apply that law of motion to any part of your body. Any part of your body that is getting sick or diseased is losing motion. I'll give you an example. If somebody has arthritis, does everybody know what that is? What if you have arthritis in your neck? Does your neck start to move more or less when you have arthritis? There's disease in that part of your body, so there's less what? Motion. Okay, and if you start to heal your neck and it starts to get better and you start to recover and drop the inflammation, your neck will start from moving less. When it starts to get better, it'll start to move what? There's more health in that area, so it starts to move more. Does that make sense? Matter of fact, I'll just give you a quick example. If somebody walks into this room right now, how would you judge how healthy they are? By how much they what? Move, she just said, right? If somebody comes in here and they're moving really good and their brain sharp, you would assume they're what? But if they came in and they weren't doing well, and they can't, maybe stay awake, and their brains feels foggy, and they're not moving well, you would assume they're probably what? Sick. And if you ever saw somebody that wasn't doing well, and you said, man, Jim's not looking like he's doing good. But then you saw him 3 months later, and you said, he looks so much better. The only reason why you would say he's looking better is because he'd be what more? Moving. Okay, so just let's backtrack a little bit. The medications that we're taking for this condition are causing more or less motion in my brain? That's causing less motion in my what? Body, okay? So I'm following a strategy that's literally breaking the law of life, and I'm going to expect that I'm going to recover and get well from that. Can you see why that'll never work? So what these lasers are doing, in a sense, are getting deep down into your tissue and your cells. Right now, your cells in your body are alive, and they're moving. Your cells are literally vibrating right now. You knew that, right? So when your cells are really healthy, they vibrate at a very high level. Okay? When they start to become sick, they start to vibrate less, and they're starting to get sicker. And if they stop, they would be what? Dead. So when you have neuropathy, a chronic condition, your nerves run out of the proper nutrition to rebuild themselves. They're getting sick and weak. It's like building a wall, and you turn around, and there's no more bricks for you to build the wall. Can you keep building the wall? Okay? Same thing. So these lasers, in a sense, are donating their energy into that body, healing the outside of the cell, the inside of the cell, returning flow, motion to all the different aspects of that cell, and as a result, that cell starts to heal, and when it starts to heal, does it start to move less or start to move more? If a lot of your cells start to rebuild and heal, you're just a lot of your own cells. So if a lot of your cells start to get healthy, who gets healthy? I do. If a lot of your cells keep getting sick, who gets sick? So just to give you a quick example, oxygen is really starting to get released into the tissue. The cells, the lasers are allowing a huge amount of blood flow and oxygen to saturate the tissue. Okay? So I want you to think about what's happening with neuropathy. Parts of your body are literally being suffocated and choked, and as a result of that, that part of your body is dying faster. So when we're doing these different strategies, it's opening up, in a sense, taking the bag off of that area, the chokehold on it, and returning life and blood flow and oxygen and nutrition. Does that seem like a good thing? Absolutely. So these strategies that we're using are amazing at doing that. So it's not about just laser therapy, high-powered or low-powered. Those are fantastic. They don't hurt you. They cultivate healing. But we have the most developed and innovative strategies in our office for neuromuscular re-education and healing. So what that means is, when many people in our office come in, do you think they have the exact same problem? No. Vastly different bodies, different problems, feet, muscle problems. So we really pride ourselves on developing and cultivating the right program for each person that comes in to correct the problems that are going on with you. So we develop a program, muscular program, neurological rehab. So we use different therapies along with laser therapy that really work on building the health and strength. Again, they don't hurt, they don't heal, it's not painful, it doesn't take a very long time, but not like physical therapy. What we're doing is not like physical therapy in our office. They're very niche-specific therapies that are really the best when it comes to rebuilding muscle strength, nerve regeneration, and getting your body back to a better, stronger, healthier place. Most of the people that come into our office, do you think it's the first place they went or probably the last? Last. People are in really bad positions, sick. They've been to lots of different doctors. That's when I see most people. They're suffering. They're not able to move much. They don't feel good. So I want you to understand, those are the people that we're most oftenly dealing with, people that have many back surgeries or neck problems or really bad neuropathy. So I want you to understand, we're trying to give people a better quality of life. And that's really what we do really well, and we really pride ourselves on. We want to build your health, and that's what I like to tell people when you come to our office. When you come to our office, we are not going to treat your symptoms. We are not going to treat your disease. We are going to build your health. Which one would you like? There's plenty of doctors out there to suppress symptoms, treat your disease. What we're really great at is building and strengthening your health. Does that sound like a better strategy? Building your health or covering up symptoms. So if you really want to do that and you really want to get well, that's the place that you want to come to, and that's what we're really good at doing.